Well, the Keratograph 5M is probably the best investment I've ever made. We opened our new office in Phoenix. I relocated from New York about a little over 5 years ago and decided to focus on ocular surface disease and dry eye and managed to create a very, very successful, very effective practice. A lot of it has to do with our utilization of instrumentation. The Keratograph is an amazing instrument. It's the Swiss Army knife of dry eye testing, in addition to being a really good topographer as well, with really good imagery that you can share with patients. So for diagnosis, it's critically important. I use mybography all the time. It's one of the most important tests. Non-invasive breakup time is really the flip side of the coin. Meibomian gland dropout, meibomian gland obstruction is a key element in the genesis and progression of dry eye. A non-invasive breakup time shows the effects that directly affect the patient. So the patient experiences discomfort largely because of an unstable tear film. There's no better way of showing that to the patient or even assessing that on an ongoing basis to see the effects of your treatment. It's a beautiful instrument. It looks great to the patient. So it has this nice medical grade quality to it. I often jokingly refer to it as the Porsche of my eye care instruments, and I absolutely love it. Well, I'm a meibomian gland conspiracy theorist, and the OCULUS is great. It's very easy to flip lids. We use the new Epstein lid flipper, which makes it simple for our technician to do it. All the testing is done up front, so this is before I even see the patient, and we have access to all of the data in each exam room. It's up when I come into the room. I begin a dialogue with the patient, talking about their condition, explaining what dry eye is. It's largely an educational process, but it's highlighted by the images of their own body parts, basically the meibomian glands. We also look at tear meniscus height. The OCULUS has a great redness index function as well. Today we're looking at, I guess, aesthetics is a growing important part of optometric care, especially with the advent of Lumify, which really helps us control redness. So we can quantify redness and the impact we're having on managing it. Most of it comes from meibomian gland dysfunction, staph overpopulation on the lids. So I find this invaluable in making a diagnosis and being able to demonstrate what's going on to the patient and reinforcing the care that we're giving the patient. And then when the patient comes back for follow-up care, I get to show them the progress that we've made, improvements in breakup time, and in many cases we see changes in meibomian gland topology, basically how the glands look, structure. Sometimes we recover structure as well. Without being able to show that, I think I'd literally be lost. Education is the essence of the equation in managing patients, because what is it that differentiates you from everything else? What is it that differentiates you from an online experience? It's the personal contact that you have with a patient. And a picture is worth 1,000 words. And if you can get a picture of the patient's physical state, I mean, literally it's game-changing for the patient. Everyone wants to know about them. And I don't blame them, that's what they're there for. It's their issues, their problems. Being able to demonstrate physically what's going on with them, demonstrating it and showing it to them is worth an incredible amount. It elevates me as a clinician because it helps me explain it and makes me look more connected to them, more aware of current thinking and the disease state itself. So I think it improves the overall patient experience. So one of the things that I think is really, really important, and I think we often underestimate that, is patients want to know how they're doing. First of all, they want to know how they're doing from the get-go. Sometimes they're in denial. They know that they have a problem. They know they have dry eye. It's been diagnosed before, but not in a way that's tangible to them. So they don't really understand the underlying cause. And I always explain that there's a cause and effect aspect to it. The effects are what they feel, and in many cases some of the things that we see, but the cause is, for many patients, meibomian gland dysfunction, which isn't obvious to the patient, and unless you're using a device that gives you decent meibography images, you're not going to even see it yourself. So that's the first part of it, is the underlying diagnostic platform that I think is very important for getting patients on board with treatment. In some cases, the treatment can be somewhat expensive, and the patients need to understand that it's important. It's critically important to understand the progressive and chronic nature of this disease process. Now, once you begin treating a patient, the patient wants to know how they're doing. Telling the patient that they're feeling better is great. If the patient doesn't feel better, sometimes you need to show them that they're better, and there's no better way of doing that than showing them, again, meibography, non-invasive breakup time. So not only are you staging therapy, but you're also highlighting the effects of the therapy, and I think that's very, very important.